When screening for trauma, we are assuming that the adult in question does not have a cognitive impairment. However, if you find that your client is having a hard time answering questions appropriately, recalling information, or you otherwise suspect that they might have a form of dementia, it's important that you refer them for a thorough medical evaluation prior to completing your screening. If you suspect your client has delirium or an infection or is having some sort of interaction with their medications, they should also be referred to for medical evaluation. That way you can ensure that your trauma-informed screening is an accurate representation of who they are and what they are reporting, and not a temporary reflection of an infection or a medication that they're taking. Assessment for trauma in older adults should be done routinely. Older adults are going to be less likely to report traumatic events and experiences, or they're going to minimize their importance because it's likely some of these events happened a long time ago, and they're not going to recognize that even though it might have happened 30 or 40 years ago, it still impacts them today. Older patients are also more likely to address things in a physical nature. They are going to be more likely to report pain, insomnia, oversleeping, gastrointestinal problems, forgetfulness, or my personal favorite with working with older adults, they feel stressed. They're less likely to describe emotional issues, and that is probably because the longstanding negative stigma and embarrassment when it comes to reporting mental health and psychological issues. Anytime a doctor or a social worker or a nurse gets a list of physical complaints, they should follow up with the client to see if there have been any changes in mood or activity tolerance, things like that, to see if perhaps these are physical manifestations of trauma. Additionally, it's also really important to recognize that these older adults may already have some sort of coping mechanisms that they use, and it's important to recognize and encourage any healthy coping mechanisms they have. This could be religious or prayer, exercise, meditation, journaling, things like that. It is also critical when screening for trauma to screen for a suicide risk. Older adults might be 12% of our population, but they are 18% of all suicide deaths. In 2002, the annual suicide rate for persons over 65 was 15 per 100,000 people. Between 75 and 84, it was 17 for 100,000 people. The number gets higher as you age for multiple reasons. It's also likely that suicide in older adults is underreported significantly because it doesn't recognize what are considered to be silent suicides, such as prescription medication overdoses, self-starvation or dehydration, and accidents that might occur. A lot of times things happen and we just think, oh, well, they were old, and we don't look at, well, they might have actually committed suicide. Maybe they intended to take twice their amount of medication, or maybe they did leave the heat on to cause the carbon monoxide. Suicide rates among the elderly are actually the highest for men over 85. They are more likely to die from their suicide attempt for multiple reasons, including that they plan more carefully and use more fatal methods. They are less likely to be found early enough to be revived. And they're also a frailer population, so they may not survive an attempt like someone would have if they were significantly younger. If one of your clients is unable to self-report for their trauma screening, if they have dementia, if they are nonverbal and can't speak or can't communicate, you can use family report if there are family members who are knowledgeable in their history. You can also use medical records. You will sometimes find in medical records different indications of trauma or medications or diagnoses that will allude you to a diagnosis. You can also look for different trauma scales and questionnaires that are based on observation rather than client actual self-report. You will see in the PowerPoint there are multiple sample questionnaires to screen for trauma and post-traumatic stress disorder. These are not all inclusive. There are several out there. If you work for a particular agency, they may have a preferred trauma screen that you use. These are just samples. These are all evidence-based and cited in the PowerPoint. So if you are looking for one to use, these are just an example. There are a lot out there.